tell me this particular answer, ninth one. A child presented with abdominal pain and rice water stool. Which enrichment media should be used to culture the following organism? First of all, you tell me what they're talking about in this question. What they're talking about in this. Selenite type broth, alkaline peptone water, Robertson Cook media, BHI. Yes. Which one? B. Alkaline peptone water. What we are thinking of? We are thinking of cholera, Vibrio. Rice water stool is sufficient to tell you that with abdominal pain. Okay. Selenite type broth. Selenite type broth is for what, guys? It is for Salmonella and Shigella. It is for what? Salmonella and Shigella. Selenite type broth. Robertson Cook media is for what, guys? Clostridium. Because it is for the obligate anaerobes. BHI, brain heart infusion broth. Brain heart infusion broth is for blood culture. Brain heart infusion broth is for blood culture. It is for the blood culture. Okay. Now, first of all, you should know the enrichment media is what sort? Enrichment media is liquid media. Okay. Enrichment media is what? It is the liquid culture media. First of all, you should know this. That they are liquid culture media. Now, let's talk about these cholera fellows. Vibrio cholerae. The lot of questions they come around the Vibrio cholerae. First of all, you tell me this particular stuff, that Vibrio cholerae acts on which particular junctions? Zona-occludens or tight junctions? This is important. They act upon zona-occludens or tight junctions. They are the same thing. First of all, you know this. Okay. You should know this, that they are the same thing. First thing is that. Okay. So this is asked, frequently asked. Then this Vibrio cholerae secretes up the cholera toxin, and this cholera toxin, which is acting on these junctions, is made up of two things, A and B. And this particular B binds to which particular receptors? This was asked in the NEET PG. GM1 ganglioside receptors. GM1 ganglioside receptors it binds. And how to remember that particular one? Remember like this. The general manager of the company is the #1 position, and we will do the cholera to that fellow only. The general manager developed the cholera. So that is GM1 ganglioside receptors are there, not the GM2, GM3. It is general manager 1. Okay, GM1. And this A, it helps in what? ADP ribosylation of G stimulatory protein. G stimulatory protein. And because of that only, there is an increase in the adenylate cyclase activity. And this adenylate cyclase activity only increases what, guys? It increases the cyclic AMP. And all the intracellular water comes to the lumen and massive watery diarrhea happens. That is rice watery stool. And rice watery stool mimics of which particular metal poisoning in the forensic? Arsenic metal poisoning. All these are important questions. You should know regarding them. You should know regarding them. Okay. Now, here only I like to tell you the recent question which came in the FMG exam that was conducted by NBE. To you also definitely can come. And that is Vibrio parahemolyticus. Vibrio parahemolyticus. This particular organism is 7% halophilic. This should be remembered first of all. It is 7% halophilic. Associates with oysters, obviously contaminated oysters, and leads to what? Seafood poisoning. It leads to which particular poisoning? Seafood poisoning. This particular oysters, it leads to seafood poisoning. Okay. And in this Vibrio parahemolyticus, what was asked in the question? That it shows a phenomena. And the phenomena name is Kanagawa phenomena on Vagatsuma agar. Kanagawa phenomena on which particular agar? Vagatsuma agar. This particular one was asked in the exam. And what is this Kanagawa phenomena? This Kanagawa phenomena is enhanced beta hemolysis on Vagatsuma. Vagatsuma is a high salt content agar because they are halophilic. How much percent halophilic? 7% halophilic. How to remember? Remember like this, that somebody have gone 7 C's over. Okay. For what? Parasailing. Okay. Suppose you have gone for parasailing. How much C's over? 7 C's over. And you eaten up after going up 7 C's over seafood. Which seafood? Oysters. Okay. Contaminated oysters by chance they are. You landed with seafood poisoning. You landed with what? Seafood poisoning. And seafood poisoning is dangerous, a sort of a type 1 hypersensitivity. You survived that, and that's why you sung a song. Because you survived, you sung a song. Kana gawa means Gana gaya. Kaha gaya? At the Wagah border. So these stupid associations will help you to remember in the exam for sure. So where you have sung the song, Gana kaha gaya? At the Wagah border. The Kana gawa phenomena on which particular media? Vaget Okay. And what you've eaten up? Contaminated oysters. Okay. So that is there, and that leads to this seafood poisoning. Is it fine, guys? So this question might come, and remember this one, as somebody have told in the comment section, that this is having a bipolar staining. This is having a bipolar staining. It is having a safety pin appearance. And which is the most halophilic Vibrio, guys? Vibrio alginolyticus. Vibrio alginolyticus. Okay. Vibrio alginolyticus is the one which is the 10% halophilic. This was also asked in the NEET PG exam. Okay. Now, one more question. What is the best selective media for Vibrio cholerae? The best selective media for Vibrio cholerae is what, guys? The best selective media for Vibrio cholerae is TCBS. Okay. What is the best selective media for this particular one? TCBS. Thiosulfate, citrate, bile salt, sucrose. That is the best selective media for Vibrio cholerae. How to remember? TC was given by whom? VC. TC was given by whom? VC.